Today I will be presenting my research disease in the hope that I will receive the $5 million to go toward more efficient ways of diagnosing and stopping my disease from being a constant danger to its victims. The disease I will be presenting to you today is severe combined immunodeficiency. SCID is a disease which causes the immune system to not reach maturity or not to function at all. It is caused by genetic mutations in 3 different chromosomes. These cells play important roles in helping the immune system battle bacteria, viruses, and fungi that cause infections. There are 14 forms of SCID, mostly affecting only males. It is a primary immunodeficiency disease. The main 3 forms of SCID are JAK3, ADA, and IL-2RG. More than half of all diagnosed SCID is formed on the X chromosome, which is also known as IL-2RG. As well as many severe respiratory infections, symptoms of SCID include little growth, bad rashes, and severe diarrhea. Due to the patient's immune system not functioning normally, they are susceptible to most diseases that cause lots of damage, such as meningitis and pneumonia, leading most patients to die before the age of 1. More examples of symptoms are chronic hepatitis, weakness, and severe weight loss. The chromosomes on which SCID occurs is chromosome 19, 20, and the X chromosome. Mutations on JAK3, which is located on chromosome 19, causes SCID. X-linked SCID is formed because of the mutations on the interleukin-2 receptor gamma, which stops the forming of JAK3. This prevents healthy development of T lymphocytes, which is crucial to immune system development. On chromosome 20, the lack of ADA means the body's immune system does not reach maturity, leaving the body unprotected. The most common forms of SCID form on 3 different chromosomes, on chromosomes 19, 20, and the X chromosome. The pattern of inheritance for SCID is X-linked recessive inheritance. This means the mutated gene was carried by a female to then be shown in a male offspring because of their only having one X chromosome and a Y chromosome. The gene which the disorder is on is the X chromosome. SCID can be diagnosed before the baby is born, but few people do it because of the expense and rarity of the disease. They compare embryonic fluid to a sample of previous sibling with the disorder. Babies aren't diagnosed straight away due to antibodies protection, and the children usually seem normal. Immediately after birth, tests can be done by counting the amount of T and B cells. The treatment as of now is to take blood-forming stem cells from the bone marrow from a healthy individual. This supplies the body with immune cells that are healthy. Patients who aren't diagnosed and treated before the age of 3 months face extreme chances of passing away before the age of 1. Hematopoietic stem cell transplantation is available today. Previously explained HCCT is when the stem cells of bone marrow is transferred to a patient who has a deficient or inactive immune system. This can save up to 80% of patients. In the future, with the money you would be providing, we wish to develop an automated system that could scan hundreds of samples every day, quickly notifying the doctor to give more time for surgery to be done and give the baby a higher survival chance. Your money could greatly increase the chance for us to save more and more unlucky victims of SCID so we could diagnose earlier and in larger numbers. Thank you, and please consider my offer to give the $5 million to a greater cause.